This episode is sponsored by the Kirtland Partnership Committee, a proud partner in supporting Kirtland Air Force Base and its vital role in New Mexico. From growing mission sets to improving quality of life for service members and families, KPC works every day to help Kirtland's workforce thrive. It's about partnership, progress, and a strong future for national security right here in Albuquerque. Discover more at kpcabq.org.
From the Albuquerque Journal, this is the leading news. I'm Gino Gutierrez. It's Friday, August 15th. Here's what we're covering on today's episode. An Albuquerque judge on Thursday ordered 18-year-old Chilikai Sanchez to remain in custody while awaiting trial for first-degree murder, armed robbery, and tampering with evidence in the August 7th shooting death of Uber driver Joseph Andres. During a recorded police interview played in court, Sanchez admitted to loading his gun before the ride, telling Andres to get out of his 2022 Ford Escape, and fired about 5 shots when the driver moved, quote, too slow. He described the killing as, quote, easy and a, quote, adrenaline rush, later saying he wanted to, quote, let off some steam and had planned to steal the car and shoot someone. Prosecutors revealed Sanchez claimed to have committed 3 other killings, including one in middle school, though he has not been charged in those cases. His attorney dismissed the claims as, quote, grandstanding and suggests he might be protecting somebody else, noting his girlfriend, not Sanchez, ordered the Uber. The case follows a separate allegation from May in which Sanchez was accused of pointing a gun at his 7-year-old brother, though those charges were then dropped due to lack of cooperation with the family. Judge Lucy Solomon called the evidence, quote, pretty high and the allegations among the worst she had seen. SWAT officers arrested Sanchez and his girlfriend after finding the stolen SUV outside of her home. The federal government has approved expanding the nation's only permanent nuclear waste storage site, the Waste Isolation Pilot Plant in Carlsbad, by adding 2 underground panels. The WIPP stores transuranic waste, items like contaminated tools and protective clothing, in salt chambers half a mile underground. The expansion, approved by the EPA in July, aims to replace capacity lost after a 2024 contamination incident. Each panel contains 7 rooms measuring 13 feet high and 33 feet wide and 300 feet long. When full, these rooms are sealed and salt gradually closes in around the waste. New Mexico approved the additional panels in 2023 with the condition that one prioritize, quote, legacy waste from the Cold War and the Manhattan Project. However, state officials say the Department of Energy has not honored the deal, particularly by failing to remove waste from a contaminated 11-acre dump at Los Alamos, instead shifting focus to other projects. Critics like Don Hancock of the Southwest Research and Information Center say the approval bypassed a more rigorous review process and fears the WIPP could face pressure to accept more waste than originally intended. By law, the WIPP cannot store high-level or commercial nuclear waste and is capped at 6.2 million cubic feet of transuranic waste. Hancock warned that without finding another storage site, New Mexico could be asked to shoulder an even larger share of the nation's nuclear waste problem. Today, the University of New Mexico Hospital will conduct an active shooter training exercise at its soon-to-be-open critical care tower, set to debut in October. The drill, which is running from morning to early afternoon, will involve a visible police presence and radio communication, but is not open to the public. UNM Health spokesperson Chris Ramirez emphasized the exercise is strictly for preparedness, ensuring staff know each floor's layout, emergency exits, medical equipment locations, and other critical safety resources. The new tower, which was completed earlier this month, will expand the hospital's capacity with 24 ICU beds, 2 operating rooms, and a new emergency department and additional MRI and CT scanners. 2 weeks after 19-year-old cyclist Kylie Van Landingham was fatally struck by a car at the Han Arroyo passing on Carlisle Northeast, Albuquerque officials announced safety upgrades at the site. Within 2 months, the city will install a HAWK or high-intensity activated crosswalk signal, an on-demand red light that requires drivers to stop, replacing the current flashing yellow lights that don't carry a legal requirement to yield. Mayor Tim Keller acknowledged the improvement was long overdue, saying, quote, it just didn't happen fast enough. Van Landingham, who worked at the city's Esperanza Bicycle Safety Education Center, was the 3rd employee there to die in a bike crash in the last 2 years. Her mother, Melinda Montoya, urged the community to push for broader safety reforms in her daughter's honor. The city also plans increased police enforcement, a pedestrian and cyclist awareness campaign, and advocacy for state law changes to require drivers to stop at crosswalks. Parks and Recreation Director Dave Simon said Van Landingham will be honored with a tribute reflecting her passion for cycling and helping others. Montoya said while no measure will bring her daughter back, the changes could prevent other families from suffering the same loss. And New Mexico has surpassed 100 measles cases this year, according to state officials on Thursday. That follows 3 new diagnoses in unvaccinated Santa Fe County residents, 2 adults, and 1 child. One case involving an unvaccinated Lee County resident was fatal after the patient developed pneumonia linked to the disease. From February 1st to August 13th, more than 48,000 people statewide have received the measles, mumps, and umbrella or MMR vaccine, including nearly 28,000 children under the age of 18. Dr. Miranda Durham, the state health department's chief medical officer, credited vaccinations with helping slow the outbreak and prevent it from lasting longer. Measles is highly contagious, spreading through the air for up to 2 hours after an infected person leaves. Individuals can transmit the virus 4 days before developing its telltale rash and remain contagious for several days afterwards. Early symptoms include cough, runny nose, and eye redness, followed by fever and a rash starting on the head and moving its way down the body. The Department of Health is asking anybody experiencing fever and rash to contact your doctor or emergency department, but first tell them you're worried about measles so they can plan for your visit. You can also call the DOH helpline at 1-833-796-8773. That's 1-833-796-8773, and the helpline is staffed by nurses who can provide guidelines in English and Spanish related to the measles and vaccination questions. The leading news is powered by the journalism of the Albuquerque Journal. If you enjoy hearing all of the stories we share with you here daily, please consider becoming a digital subscriber to the Journal by utilizing the discount code in our show notes. Every subscription helps support local journalism and allows us to provide you with the news that matters to you. Now taking a look at Albuquerque's weather forecast, scattered showers and thunderstorms are expected today after 12 p.m., mostly sunny with a high near 95. As for this evening, showers likely and a possible thunderstorm before midnight, mostly cloudy with a low around 67. To keep up with all the latest news from the Albuquerque Journal, you can visit our website at abqjournal.com. That's the leading news. I'm Gino Gutierrez. We'll be back on Monday.